So, Doc, thank you for coming in. Greatly appreciate it.
Not at all. Thank you for inviting me. I appreciate it.
Yeah, so, Mo, can you please give a shout out to, because you haven't been here in 2 months.
Been in a long time.
You know.
First, thank you, Dr. Macaluso. And I thought...
That's my pleasure.
I thought Sean was going to introduce me as a guest because I've been away so long.
Oh, did I introduce you? Oh, my bad.
No, it's all right, man. No, it's funny, man. It's first time back in a long while. But great to be back. I was doing a little bit of work overseas to complete my studies at the SUNY Downstate College of Medicine. And we could talk about that later because we got the topic of stroke at hand, which is major league important. But I will elaborate on my experiences overseas in Taiwan, and we can get into that, some of the stuff that I've learned, the insights that I've gained over the last couple of months.
Because guess where I'm going in October?
Where
I'm going to Italy and Greece to do my residency.
Okay, so we got a lot to talk about.
Yeah. See, you did on the medical side. I'm going to do an administrative side,
That's dope.
Universal health care. So, you know.
But you know what? One thing that I definitely know is an issue, not just here, but overseas, is this issue of stroke, which I remember when we first started talking about this topic, we had Dr. Williams, Dr. G.D. Williams from Harlem Hospital and Columbia University, and the hip-hop stroke program. We talked about this before. He said this is a brain attack. So the importance with which we talk about heart disease and we talk about heart attacks, this is how serious we need to treat this disease, ladies and gentlemen. And Dr. Macaluso, what would you say is
I agree with you 100%, and G-Day's done a wonderful job in Harlem to try to bring it out to the open and to the public, and educating the younger people to bring the message home to their parents and their families. So I think that's terrific.
So let's jump right into it. Dr. Macaluso, what is a stroke? Can you give us the detail of what it is, the type of stroke? Spotlight's on you right now.
Sure. A stroke simply is, if you think about irrigation of a garden, if you have several hoses going to the garden and one of those hoses is blocked off, you're going to have that part of the garden suffer. So if you think of your brain as a garden, a stroke is a blockage of one of the blood vessels in the brain, which lasts long enough to cause damage, and the damage is often permanent, and with very dire clinical consequences. And just to give you an idea of just how serious this problem is, stroke is the third leading cause of death in the United States, and the only things that beat it are heart disease and cancers, all of the cancers together. And every year in the United States, we lose 130,000 Americans to stroke. Death. So 130,000 deaths.
130,000 deaths due to
year.
stroke?
So if you work out the numbers, that's one American dies every 4 minutes of stroke.
What?
So every year, we also have about 800,000 Americans that have a stroke. 600,000 of those this is their first stroke. They've never had one before. That's over a half. It's really a tremendous number of people. 600,000 people. 200,000 of that 800,000 have recurrent strokes. These are people that have had strokes and are plagued again with the same problem. So almost 90% of these strokes, about 87% of these strokes, are what are called ischemic strokes, which simply means that there is blockage of blood flow to a certain portion of the brain. The other types of strokes that we can talk about are hemorrhagic strokes, where there is actually rupture of a blood vessel or leakage from a blood vessel. But ischemic strokes is clearly the most common.
Wow. So are we seeing an actual increase in these numbers, or are these numbers staying flat from year to year?
There probably is a small increase simply because patients are living longer, and also our ability to study and record the number of strokes and their complications is getting much better, and especially with universal health care, that also will continue to improve. It's a huge burden on society. We're talking about $73 billion.
Whoa!
That was in 2010, and that includes the treatment of stroke, the missed days from work, and everything that's associated with stroke. So $73 billion in 2010. So you can imagine what those numbers are today. They're huge.
And I'm thinking about right now, as far as the whole cost containment, the Affordable Care Act, and I know that cardiovascular disease is one of those ailments that if you have a patient that's reoccurring that keeps being admitted into the hospital because of, let's say, a heart attack, you necessarily, or the hospital or that doctor necessarily would not get reimbursed because it's so expensive. And I don't know if stroke falls into that same category, but I know that cardiovascular disease is one of those.
Yeah, I think more of the issue is trying to get some control of the quality of medicine.
Yes, yes.
So
yes.
if you have a patient who is readmitted for the same problem when it could have been fixed, you're not going to get reimbursed.
Correct.
Which seems fair.
Correct.
But clearly, people that have heart attacks or strokes will have additional heart attacks and strokes, and those will be reimbursed because they're new events. We do our best to try to prevent them, but there's only so much that we can do at this point. And in comparison to when I started 30 years ago, what we can do today is huge in comparison to what we were doing before.
So let's talk about real quick. First thing, and I want to touch on, what are the age groups that are affected by this disease?
Well, stroke can occur at any age, and sometimes people are surprised by that, but we have had patients, and especially in the African American population, in their 20s and 30s. It's a scary thing to watch. So it can occur at any age. The most common age group is over the age of 65.
Wow. But you know what, and just from my limited experience up to this point, I mean, Dr. Macaluso has been practicing a number of years before I even got started. But I'm just telling you, just from my little clinical experience over the last year and a half or so, I've had at least 5 or 6 patients suffering from strokes, and we're talking about young people, young, vibrant, very productive people that, this happens to them. So this is not just something that we're talking about, our grandparents dealing with, or older individuals, and it's not just something that that we would typically associate with quote unquote non-healthy individuals. We got people that are trying to do the right thing, but this happens. So one thing, hopefully, by the end of this show, is that we'll be aware of not just what leads to a person being susceptible to stroke, but also how to recognize it, because how to recognize it and making sure that a person gets help is probably the most important thing that we can get out of.
And that was my next question, Dr. Macaluso, sorry about that, is that, and I don't know if you mentioned it, so what causes the stroke?
Stroke can be caused by several different mechanisms, the end result all being the same, damage to the brain. Think of it as a brain attack. So probably the most common mechanism for stroke is where blood vessels are damaged by high blood pressure, diabetes, high cholesterol, all of the risk factors that we can talk about a little bit more. But these vessels are damaged. They try to repair themselves. There is a formation of what are called plaques. These plaques can grow, can actually rupture, and eventually can cause either blockage of that blood vessel, or sometimes actually pieces of that vessel wall will actually break off and move further down the road and then go block a smaller vessel. So it's a matter of the size of what breaks off. So that's called a thrombotic stroke. And then embolic stroke, on the other hand, is a stroke where a piece of clot or debris of some kind within the vessel or the heart breaks off and moves and goes to the brain and gets lodged in the blood vessel, which will be the smallest that can hold that clot. There's a condition called atrial fibrillation, which I'm sure many people are familiar with. It's an irregular heart rhythm. It's fairly common, and one of the things that happens is that the blood is not pumped efficiently through the heart. So in one of the chambers, that blood can stagnate, can clot a bit, and then at some point those clots can move, and when they move, unfortunately, they go to devastating places, to the brain. And depending on where they go is the type of stroke that you would have. There are certain symptoms that are much more common than others, simply weakness, numbness, difficulty with speaking are the 3 probably most common things.
So when you actually have a stroke, the blood vessel in or some of the blood vessels in your brain burst. And what is that? What is that called again?
That's a little bit different. That's,
okay.
That's an intracerebral hemorrhage.
Okay.
And that can be caused by two different things. So we talked about ischemic stroke, which is either a thrombus or an embolus.
So some sort of blockage of the vessel.
That's right. The vessel is not allowed to carry the oxygen-rich blood to the brain. When a vessel breaks, that's a hemorrhage. That's where you have leakage of the blood into the brain substance itself, and in doing that compresses the brain tissue and causes the damage. There are two major things that do that. High blood pressure being number one. That's why it is so important to keep this pressure under control, to have it checked periodically. We're doing so many things to make blood pressure checks accessible to the population, and they just need to take advantage of that.
Got it.
So that's number one. And number two, there's something called the subarachnoid hemorrhage, what we often think about with aneurysms, where a blood vessel doesn't break because of high blood pressure necessarily, but because there's been some kind of congenital abnormality in the blood vessel, and then at a certain point it leaks or ruptures. If it leaks, we're lucky, and maybe we have a chance of fixing that. If it ruptures, it can be fatal.
Wow.
Got you. Well, heavy. You're listening to Health in Harlem and WHCR 90.3 FM New York, the voice of Harlem. We're going to take our first break. The time right now is 7:15. We're going to take our first break. But if you have any questions, comments, concerns, you want to hit us up, give us a shout out, give my boy Noah a shout out, please hit us off at 212-650-6903. That's 212-650-6903. We're going to take a quick break, and we will be right back.
Yes, sir.
WHCR 90.3 FM, New York.
If you know the symptoms and get the facts, you'll know the signs of a heart attack. Women, listen to me, and when I'm done, if it sounds familiar, call 911.
Pain in your neck, chest,
arms or jaw,
shortness of breath.
Please tell us more. Cold sweats and nausea, tiredness.
It's time to take it
serious. Back pain, stomach pain, shortness of breath. Cold sweats, nausea, dizziness. If you know the symptoms and heed the signs, you'll be around for a long, long time. Women, listen to me, and when I'm done, if any sound familiar, call 911.
Learn the song that could save your life. Get a free download at womenshealth.gov/heart attack.
Women, listen to me, and when I'm done, if any sound familiar, call 911. If any sound familiar, call 911.
A message from the U.S. Department of Health and Human Services.
911.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Good evening, ladies and gentlemen. We are back. This is Sean Shivers.
And this is Maurice Selby.
I gotta get used to that.
It is odd, right?
And you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. And we have Dr. Macaluso. Again, I apologize.
No problem.
He's the assistant attendee at the Neurology Department at Harlem Hospital Center. And tonight we are talking about stroke. So, to give a brief summary of what we talked about last segment, 30 seconds real quick, my boy Noah. You can do that better than I can.
Okay, so I'll try to sum it up. And basically Dr. Macaluso told us that stroke is essentially a brain attack, ladies and gentlemen. And I loved your analogy of a garden. And we can think of this garden as being, you have your water and you have your sprinklers providing some nourishment to the garden. And if you have a blockage in any of those hoses, then a portion of the garden will die. And this is the same thing. We can think about the blood vessels in our brain feeding the garden that is the brain tissue. And when any of these blood vessels become blocked, or it could be, as Dr. Macaluso said, even a bursting of the blood vessel, then you'll have a portion of the brain that is not being supplied the vital nutrients that we need to sustain life, to sustain those cells in the brain. And then we have the death of these neurons, and you can see actual signs, some of the things that will take place. Actually, Dr. Macaluso will probably elaborate on that. But this is a very dangerous condition, and we talked about some of the things that cause it, including atrial fibrillation, like throwing clots from the heart, or even the blood vessel, because it's damaged, actually clotting up and blocking the vessel. And even the dangers of high blood pressure and how that could lead to these blood vessels bursting in the brain.
Can I jump in 1 second? I remember the last time we were talking about stroke, the analogy that you used, or the guest used, was a tremor, and then the actual stroke itself is the earthquake. I don't know. Was that? Remember we talked about that?
Interesting.
That was an analogy that you had used before. I don't know how you used it. It just popped up in my head.
Listen, a little while ago.
Okay.
I think we were talking about it wasn't me, but probably Dr. Williams.
Okay.
The concept of TIA, transient ischemic attack, and I'm so glad you brought it up. This is so important.
Yes, that's
this
what it
is
was.
so important. This is, it's one of the few things that really gives us a warning that something is going
wrong,
terribly bad, and badly, and we need to do something about it. So TIA stands for transient ischemic attack. And that's exactly what it is. It's a transient decrease in the blood flow to a certain portion of the brain, which will cause any symptom, but more commonly it'll be numbness or tingling or difficulty speaking. One of the more common ones also is loss of vision in one eye, if the carotid artery is involved. It'll be just a transient loss of vision. It's something called amaurosis fugax. It's just a fancy Latin word for just means transient blindness. And most patients will describe this black screen that comes down, the curtain coming down and making you blind, and lo and behold, that vision comes back. But it is such an important sign not to ignore. And really the message here is not to ignore any neurological signs, whether they last for 2 minutes or 2 days, whether they affect your activity of daily living or they don't. You really have to pay attention. You have to get to the doctor at that point to try to prevent that tremor from becoming an earthquake.
Now, one thing that we've been talking, because we've been having different segments about stroke for the past couple of years, and every time we have a topic, I always learn something new, something more in depth. But one of the symptoms, I guess, we're talking about it. I could just be having a normal conversation with you, and all of a sudden, I'm thinking I'm talking normal, but then I start slurring and my face freezes up or something like that. Can you get into that symptom?
Of course, sure. Well, one of the things that we always try to use acronyms to help people remember what to do, what to think about when something like this is occurring. So the acronym FAST, F-A-S-T, stands for face, arm, speech, and time. So when you want to see if a patient maybe is having some kind of neurological event, you look at the face. You ask them to smile, and when they do that, if one part of the face, one side of the face, is not moving the same as the other, it's possible that they're having a stroke. You ask them to lift their arms, raise both arms, and see if one will drift downwards and the other one not. And then speech. Speech is very important. A few things can happen. One is the speech can become slurred. It can be less clear, or you can have what's called an aphasia, or a difficulty with speaking, so a difficulty with expression. So you can be speaking nonsense, you can have difficulty finding words, You can even have a different type of aphasia where you have difficulty recognizing words, so you won't be able to understand, even though when you speak, it'll be fluent. So these are these very interesting neurological phenomenon. But the bottom line is, if there is a problem with speech and it's new and it's sudden in onset, get to the doctor. And that last T in fast is for time. Time is of the essence here. Minutes mean brain. Seconds mean brain. So if you're having symptoms of this sort, mosey onto the car and try to drive yourself to the hospital. And you don't ask your cousin that lives 3 blocks away to bring you to the hospital. You call 911.
Yes.
Because the treatment starts as soon as the EMT gets there. He can notify the hospital that you're on your way. They'll be ready for you. They'll get you into the CAT scanner right away.
Yes.
And that stroke team is activated and ready for you. And that's where you're going to have the best possible outcome, not waiting around at home.
Can you have permanent brain damage? And this is a question I'm looking on my list of questions. Can you have like permanent brain damage? Let's just say if you're having a stroke and it's not treated within 5-10 minutes. Is that possible?
Yeah, the brain requires oxygen-rich blood for 24 hours a day, 7 days a week, as long as you're living, and it tolerates very little in the way of alteration from that, deviation from that. So yes, within 10 minutes there certainly can be injury. Luckily, there are mechanisms through nature where even if a small vessel is blocked off, God is good. He opens up the blood vessels around there, around that area that's suffering, and sometimes we can reperfuse, or sometimes that blood vessel that's clogged will open up again. So it doesn't necessarily have to be permanent after 10 minutes. But what we can say, a very, very important point here, is that the transient ischemic attack, we always talked about transient ischemic attacks being events that last less than 24 hours. That was a definition that you saw in every textbook. With MRI, things have changed. We know now that most transient ischemic attacks will really only last a few minutes, maybe a maximum of 2 hours. After 3 hours, what we've called transient ischemic attacks are actually small strokes, because now the MRI can pick that up. We know that there is damage, even though clinically
things seem normal.
Exactly.
This is interesting. And the thing is, ladies and gentlemen, I think I'm going into emergency medicine, so I'm always thinking now from what we do in the emergency room. And I'm glad that Dr. Macaluso said that, call 911, because there are mechanisms in place in EMS, the emergency medical services, the 911 system, in the emergency room. And then there's also, as Dr. Macaluso said, stroke teams. So everyone, and the people are specially trained at each level to recognize stroke and to get these teams activated as soon as possible. So as he said, as soon as you come in, you get the CAT scans and we can give you the appropriate therapy. And this is why it's important for you to, when you call 911, give them details of what's going on with the person, so that they can send the appropriate unit and make sure that the appropriate hospital is notified as well, because there are designated stroke centers in New York City where we can deal with this problem. All right, so take note of that fast mnemonic and make sure you burn it into your memory, because it's critically important. So
Dr. Macaluso, so let's just say I'm a patient. It feels like I'm about to have let's just say I think I'm having a stroke, and let's just say that I call 911, the paramedics come, and a lot of times the paramedics put you on a stretcher and they start doing different things, and then you go into the emergency room and they start doing different things, and you're there terrified. So tell me, can you tell us what they will do to you? A summary of that?
Absolutely. The emergency medical services is such an integral part of stroke diagnosis and management. It's really in the forefront. As a matter of fact, New York State, and most of the states do it this way, they break up the state by districts based on EMS. And in New York State, I was just looking at it this morning, there are 15 districts, New York City being obviously a huge district. There are 119 stroke centers in New York State. And I believe there are about 13 or 14 in New York City, in Manhattan.
Oh, wow.
So, yeah, I was surprised at how many there are. But I think, any modern hospital today has to become a stroke center, has to be a qualified stroke center. So the EMS is so important because they know which hospital to bring you to, make sure that it is a stroke center. They will advise the hospital ahead of time, which means that someone will be waiting for you at the door. And we're blessed at Harlem Hospital. We just have we have a new building, the Mural Building, and in that Mural Building we have a brand new emergency room. It's a
State of the art.
Yeah, state of the art. Not only beautiful, but it actually works.
Yeah.
All right.
It's huge. It's huge. And we're very proud of that. And one of the greatest things that most large centers have in Harlem Hospital is a wonderful hospital, but it's not a huge center. It's about 300 beds, but we have a CAT scanner literally 50 paces from the door. So a patient comes in, the emergency room physician, which will be you soon.
Yes, indeed. Yes, indeed.
You'll examine the patient on the way in. They're rolling them in. I lift up your arm, smile at me, and you go straight to the CAT scanner because that's the most important thing at that moment, because we need to know whether or not we can treat this patient with clot busters, and we need to know whether or not there's been a hemorrhage, and we'll get into that a little bit more.
Yeah.
Got it.
Yeah, excellent. Because the time right now is 7:30. I want to be a doctor in the ER, but I couldn't take the blood. I just be the administrator.
You're a chef, man. It's a lot worse in the kitchen if you ask me. No.
Chef now, pretty soon.
Easier in the kitchen.
I'd rather hang out with chefs anyway.
Yeah, exactly. There we go.
You're listening to Health in Harlem on 90, look at me, WHCR 90.3 FM, New York, the voice of Harlem. We're going to take a quick break, and we'll be right back. But please hit us off at 212-650-6903. That's 212-650-6903. Mo, next week you're going to be sitting right here, right?
That sounds like a plan.
We'll be right back.
Here.
All right.
WHCR 90.3 FM, New York.
WHCR is doing it again, giving you an opportunity to show your support while having a great time. On Saturday, May 17th from 9 p.m. to 2 a.m., WHCR's house DJs come together to bring you Uptown Saturday Night, a house party fundraiser like no other. You decide how much you want to pay to party. No donation is too large or too small. So grab your dancing shoes, your whistle, and your donation, and dance to the sound of house and classic dance music by WHCR's DJ Stunner of House in Harlem, the dub master Mike D of Mystic Vibes, and DJ Howie D of The Love Zone. That's Uptown Saturday Night, a house party fundraiser, Saturday, May 17th, 9 p.m. to 2 a.m. at Adar Lounge, located at 1637 Park Avenue at the corner of 116th Street. Remember, your financial support ensures that some of the best music, most informative, and educational programs continue to be heard on this station.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Yes. That is not the way that it's supposed to be. No. We were meant to live in peace.
Good evening, ladies and gentlemen. This is Sean Shivers.
And I'm Maurice Selby.
And you're listening to Health in Harlem on WHCR 90.3 FM, New York, the voice of Harlem.
The voice of Harlem. Try to sound like Sean now. More bass.
And tonight we have Dr. Macaluso, I said that right?
Yes.
Great.
From Ridgewood, New York, originally from Ridgewood, Queens.
And our topic tonight is stroke.
That's right.
But before we actually get back into the topic, I want to give some statements from Mr. Nisora. She's the executive director at Harlem Hospital. She's my boss. She's a mentor. And on Monday, it's Memorial's Day. So
True story.
On Memorial's Day, we pause to recognize and celebrate our heroes and sheroes. Memorial Day is a national day for recognition for those who lost their lives while serving in the United States Armed Forces. In all 5 boroughs of New York City, there will be parade memorials and services honoring the brave men and women who have served in times of war. While you are enjoying these 3-day weekends with your friends and family, please remember to salute those who have given their lives in service to our country. And that's from her. And another thing I want to mention, and I should have mentioned this last week and I didn't, this is from her as well. May 2014 is Asian Pacific American Heritage Month. In honor of Asian Pacific Americans, she would like to take a moment to acknowledge and thank you for being part of the Harlem family and the Harlem Hospital Center family. Just going to throw it out there like that. So that's from my boss.
That's what's up. And Dr. Macaluso has a shout out.
I do. And talking about Memorial Day, I just start to get the lump in my throat. I got to give out a shout out to my daughter.
Wow.
Yes.
My daughter Adrian, who's in Afghanistan.
Okay.
Wow.
She's got 3 beautiful babies here in St. Louis, and her great husband Chuck is taking care of the home.
Gotcha.
But she's going to be back in August, and I
Yes.
just wanted to tell
Excellent.
you, Adrian, we love you and we support you all the time.
What branch?
She's actually the Defense Department, and
Defense,
that's all I
okay.
can say.
Got it. Oh,
Got
all right.
you. And from me and from us, from WACR, from Health in Harlem and Harlem Hospital, we hope and we make sure you come home safely.
True
back to
story,
us.
man.
Okay.
Thank you.
No problem. All right.
My
So let's get back on the topic of stroke.
Yes. So one thing actually that we were talking about, and I think we just need to delve into it a little bit further. We talked about some of the risk factors. You mentioned high blood pressure. You mentioned atrial fibrillation, which there are people out there walking around with this condition that don't even know that they have that, just like the high blood pressure. But there are other risk factors, correct?
Absolutely. We have to talk about heart disease in general. Almost any condition of the heart, the heart is just one big blood vessel and muscle, will affect the possibility of having a stroke. High blood pressure, we talked about, atrial fibrillation. High cholesterol, very important. More so now because there's something that we can do about it. These wonderful drugs, the statins, we're able to bring these levels down to points where it really does modify the risk for stroke. So it's very important to have those checked on a regular basis. Diabetes, very prevalent in the African American community. If it's uncontrolled, it wreaks havoc on the blood vessels. If it's controlled, it doesn't have to. So it's again so important to keep control of that. Obesity, the education about healthy lifestyle, about the importance of fruits and vegetables and smaller amounts of meat, the importance of low fat, low salt diets. Very difficult to do, especially if you're someone who really loves food, and we have a chef here.
You're just talking
us.
about.
I love food.
But almost everything is acceptable in moderation, except things like smoking. There is no safe number of cigarettes you should smoke. Smoking is not allowed. Not if you want to reduce the risk factors. Not if you want to reduce the possibility of having another stroke. Drugs, street drugs, illegal drugs. Huge role in stroke in the young. Cocaine, crack cocaine being the number one culprit. Methamphetamine being another huge problem. And then there are other medications that are not illegal and certainly are used for the good of the population, but they also can increase the risk of stroke.
Wow.
Oral contraceptive pills. That's the one that really comes to mind. Steroids in general. Steroids are very useful to the treatment of lots of rheumatological diseases, but in high doses also increase the risk for stroke. And then there are certain illnesses, certain diseases. And again, we're here in Harlem, and I want to talk to that population. To your,
Yes.
sickle cell anemia is the number one congenital or inherited disease in African American population. Sickle cell anemia also has the capability of causing stroke just by causing the sludging in blood vessels. So cells kind of clump together, they form clots and cause stroke. So again, in higher ratios than one would expect. And then almost all of the cancers put you at a little bit higher risk of stroke. And most of the autoimmune diseases, again, where the incidence is higher in the African American population. It's things like lupus and sarcoid especially.
Sarcoid, wow.
All of these things put you at higher risk for stroke. So regular follow-ups with your doctor, once or twice a year when you're a young person. When you're older, maybe more frequent than that.
So we can get those levels checked, those cholesterol levels. We can check for different diseases and risk factors.
And not even that, I just want to mention
Blood pressure measurements on a regular.
I want to mention, as far as Harlem Hospital Center's recent Community Needs Assessment 2012, this in Central Harlem, out of all the 5 boroughs, we still have the highest in cardiovascular disease, asthma, HIV and AIDS, cancer, hypertension, diabetes. It's crazy, and I know that a lot of individuals in Harlem are working together to try to eradicate, try to control, trying to educate, but we need the community to learn that, in New York City, our community is the worst, and, we need to start taking better care of yourself. Just want to throw that out there real quick.
Absolutely. And, there are some things that we can change and some things that we can't change. You can't change the fact that you're a man, which puts you a little bit higher risk for stroke. You can't change the fact, that your genetics is what it is. If you have a family history of stroke, chances are that you're going to be at risk also. But there are so many things that we can modify, the things that we can do, blood pressure, diabetes, all of these things that we just talked about, that I can't stress enough the importance of regular follow-ups with physicians.
Now, I wanted to now, can we talk a little bit more? You threw a lot of we call it preventive medicine, but can we get more into treatment? Let's just say you are an individual, you do have a stroke, you come through the ER, you're treated, you're now an inpatient. What type of treatment are they going to give you while you're in the hospital? And as far as patient education, what does a person then have to do once they're discharged?
Okay, great question. Well, if you come to Harlem Hospital or any of the stroke centers and you are a candidate, first of all, you have to arrive at the hospital within a 3-hour period. It's really just a critical period, and the sooner the better. The 3 hours is really is it. Beyond 3 hours, it really becomes difficult to do any specific treatment. If we talk about ischemic stroke, where there's a clot that's blocking a blood vessel, and we are able to use our stroke team to check all the blood work that needs to be checked, do the CAT scan, do a clinical evaluation, get an appropriate history from patient if possible and family if not, and decide whether or not this patient is a TPA candidate. TPA is a clot buster. So in cases where patients are readied by that 3-hour mark, we can give this medication, which is given intravenously in the vein, and it goes throughout the bloodstream, and we hope that it breaks up the clot that's causing the stroke. The obvious potential side effect is hemorrhage, bleeding into the brain or bleeding someplace else. But there is a very long list of firsts, things that we have to do first before we can give this medication. So we are very careful about doing that. So as far as specific treatment, that is the most important one, because 87% of strokes are ischemic strokes. Most of the patients that come in will have a stroke that could be treated like this, unless they have the other criteria, which eliminates them. So there is always that potential. If they're not candidates for TPA, there are other things that can be done, and this is where some of the regional centers come in, where specific therapies, specific interventions can be done. And there are 2 types. One is endovascular intervention, where a catheter is placed usually in the groin, and it's fed past the heart and into the brain, and we try to find that clot. And there are 2 devices now that are FDA approved, which, when I first started out almost 30 years ago, was unheard of. You wouldn't even think about doing something like this. And now it's gotten to the point where we've had, I believe, about 8,000 patients now that have had an intervention with something called a Mercy device, which is a mechanical retractor of an embolus. And this catheter is placed into the blood vessel, into the clot, and once it's past the clot, the end of the catheter is fed with a wire with almost an umbrella that opens up, and it drags that clot out. Very delicate work. It has to be done by people who really know what they're doing and well trained. So that's a Mercy device, and then there's something called a penumbra, where it's the same type of thing, where it's got a little vacuum hose at the end of the tube, and we try to vacuum out that clot. And the good thing about these procedures is that 3-hour window is no longer so strict. Here we can go to 4.5 hours, we can go to 6 hours, even up to 8 hours.
Wow.
To try to save as much brain as possible, because even though that blood vessel is clotted and closed, there are other blood vessels that are opening up and trying to save that brain. And if we can get that blood vessel opened, that brain, which is injured but not dead, we can save it.
Yes.
And it makes a huge difference in people's lives. It makes a difference between being able to speak and not, being able to go back to work and not, being able to walk and not. They're really revolutionary procedures. They're wonderful procedures. Other than that, that's the drama. That's the nice stuff that you see on TV. But for the most part, patients are stabilized. We know the best way to treat them through the stroke team, and we place them on the appropriate medications, whether it be a anticoagulant, a blood thinner, something like Coumadin or one of the other medications, the newer medications, or the best staple, which is aspirin. Aspirin is terrific for preventing strokes. And the use of statins, which lower the cholesterol, which also reduces the risk of stroke. And we try to stabilize them as best as possible. And then the hard work comes of rehabilitation. If it's a short-term type of rehabilitation, if the deficits are not so terrible, usually we can do it right here at Harlem Hospital in our rehab unit. 2 weeks or whatever it takes, inpatient rehabilitation, and then maybe some more at home. If the stroke is more devastating, you need a longer-term facility, and there are lots of excellent ones out there.
Got you. So we're going to talk about that when we return. You just gave a lot of valuable, heavy information.
Yes.
I want to thank you for that. You're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. We're going to take a real quick break, but if you have any questions, comments, or concerns, please hit us off, 212-650-6903. That's 212-6903. Did I say that right? Yeah. We'll be right back. Stay tuned. Stay with us.
WHCR 90.3 FM New York.
Today in school, I learned a lot. In chemistry, I learned that no one likes me. In biology, I learned that I'm fat and stupid. In English, I learned that I'm disgusting. And in gym, I learned that I'm pathetic and a joke. The only thing I didn't learn in school today is why no one ever helps.
Kids witness bullying every day. They want to help, but they don't know how. Teach them how to stop bullying and be more than a bystander at stopbullying.gov. A message from the Ad Council.
WHCR 90.3 FM New York.
Oh yeah, healing all around the world, nation to nation,
Good evening, ladies and gentlemen. I told you we was going to have a quick break.
That was
We're
so
back.
fast.
Yeah, very fast. This is Sean Shivers, and I'm your host tonight. And I got my boy
Maurice Selby.
And you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem.
The voice of Harlem.
And we have Dr. Macaluso.
Macaluso.
I'm so sorry. I'll get it right.
It's all good. It's all good.
It's fine.
I've been called a lot worse.
He was called Selby.
And our topic tonight is stroke, but my boy Mo got a quick message out there to the men in our community.
Yes, men, listen up. Harlem Hospital Center wants to let them empower you, right? Regardless of your ability to pay or your health insurance status.
Free.
I'm talking about the men's clinic.
Free.
And it's free, totally free.
Yes.
Men's, actually, I'm just going to explain out the acronym here. It's men's clinic, men's empowerment networking services. And family planning is a man's business too. So we want you to know about this. They have various services available, everything from physical examination, HIV and STD screening, colorectal cancer screening, laboratory testing, you name it, they have it, including family planning, Medicaid for men enrollment, and even health education workshops. So they want you to get there so you can know your health status. They want to know when was your last checkup. Do you know how to protect yourself from sexually transmitted infections? Everything is there for you, all of the men out there. So we need you to take advantage of this service at Harlem Hospital Center. The family planning program for men is in the Ronald H. Brown Pavilion on the second floor. The Ronald H. Brown Pavilion is located at 46 West 135th Street. And you can call 212-939-8275 for more information. That's 212-939-8275 for more information about the men's clinic.
So
we're going to recap what we've talked about tonight regarding stroke, ladies and gentlemen. Dr. Macaluso told us that this is a blockage of blood vessels in the brain, either a blockage or a rupture of blood vessels in the brain. And basically, our brains are so dependent on oxygen and glucose and all of the nutrients that are getting there that we can't afford any interruption in blood flow. Interruption in blood flow means neurons, the basic cells that make up your whole brain, they will die without blood. So we have to have the blood there at all times. Yes.
I got a quick question. My quick question is, we always talk about a blood clot. What is actually a blood clot? Is that can you answer that?
Yeah, it's almost a generic term because a clot is just a clump, but blood clots can be formed by lots of different things.
Got you.
In cases of atrial fibrillation, most of the blood clot is made up of red blood cells. Okay, they're not able to move, so they kind of stick together and form this clot. In smaller strokes, it doesn't necessarily have to incorporate a lot of red blood cells. It really is a function of platelet problems. And the platelets are these little sticky, amorphous beings in the bloodstream that help plug irregularities in the blood vessel. They do lots of things. They form normal clotting, but when they become too sticky or the blood vessel walls are really too damaged, they also can form small platelet clots. So it's also a blood clot that's made of platelets, and those will cause stroke. When you have injury to a blood vessel because of hardening of the arteries, is the term we used to use. So these ulcerated plaques, the actual wall of the vessel is exposed to the bloodstream. Those platelets tend to stick to that, and they stick to the point where they can form a clot, a platelet clot. And unfortunately, that usually breaks off and goes someplace else to cause a stroke.
Thank you. Appreciate that.
Not at all.
Thank you.
Wow. And as far as some of the risk factors Dr. Macaluso mentioned, and just throw them out there if I miss any, Dr. Macaluso, but you talked about smoking, high cholesterol, heart disease, autoimmune problems such as lupus, even genetic diseases such as sickle cell anemia, and even high blood pressure. People with cancer are more susceptible to having strokes. So there are a lot of things that we need to look out for, but one thing that you differentiated between was modifiable risk factors versus non-modifiable, and we talk about that. We're talking about things that we can do regarding our lifestyle.
So we'll talk about every single week on the show.
So increase physical activity so that you can reduce your chances of being obese. You can reduce your chances of developing diabetes.
Stop taking that bus. Stop taking that bus from 145th Street to 125th Street. It's nice outside. Just walk.
Word out. It's springtime, man.
It's nice outside.
Let's get out there and start walking. There's all sorts of events going on. We got Fleet Week is back in New York City this week for the first time in 2 years. So there's all these events going on all around town for this Memorial Day coming up. But let's start the trend now. Let's start going out now as the weather starts to break and start to develop these good habits.
Yeah, when you start to get as old as I am, you realize that life is a gift.
Yes.
But even more than that, health is a gift. And the longer you can hold on to that health, so much better for the rest of your life.
You're right.
And if you can modify those risk factors, one of the things that we didn't talk about and I should have talked about is alcohol too.
Wow.
Wow. A little bit of red wine, yes, is good. A little bit of wine in general is good, but excess amounts of wine or any type of alcohol is very detrimental. It's very, very harmful to the blood vessels themselves, as well as your liver and your brain.
You're right. As we say, drink the water. We say exercise, drink water, limit your alcohol, limit the smoking, eat healthy, stay away from the fast food. That's something that I have to do. But stay away from the fast food, eat the fresh fruits and vegetables, eat your protein, eat the correct portions. If you don't know what the portion is, take a fist and put your fist on the plate, and that's the amount of food that should be on that plate. Just throwing things out there real quick.
Yeah, and,
so basic. Yeah.
One of the things that I didn't mention that I think is important also, the highest incidence of stroke in the United States is in the southeast. Places like Louisiana, Tennessee, Mississippi, all the places.
Bourbon Street.
Around the holidays.
In trouble.
Around the holidays.
all that wonderful food, but
soul food.
We have to be smart, and we have to use our common sense about the choices that we make.
Gotcha.
I have to take my own advice sometimes also, but you have to be careful about the amount of fat that you consume, the amount of salt that you consume,
but
the portions.
I think I can honestly say within the past couple of years, I do see a change. And when I say a change, I think people are becoming more educated.
True story.
People are becoming more educated. People are what's the word when it comes? You were just saying about life,
What's that?
They're lost my train of thought. Go on, move next.
It's all good, man. But I agree. I definitely see people trying to take the necessary steps to, live a healthy lifestyle. The thing is, you have to watch the information that you get because and make sure that you have the right information and you're taking the right steps. Just because you got broccoli, you got beef and broccoli, if you got it from the Chinese restaurant, if you got it from the Chinese restaurant, you're not getting the right vegetables. You got vegetables, but there's some other things that comes with, such as the cheese and broccoli or that beef and broccoli from the Chinese restaurant loaded in grease and all of that stuff.
MSG,
tastes good, MSG and all that, but it's not. That's not what we're talking about.
I'm going to talk about my heritage, is the Sicilian in me.
Okay, got it.
So Mediterranean diet, olive oil, fresh fruits and vegetables, fish, lean meats. That's the way to go, and certainly that's what I was brought up on. And very, very quickly as I got older, my diet changed much more to an Americanized diet. We have to try to go back to that European, or we're not so much European, but Mediterranean type diet. Try to ward off some of those fats that are killing us. Literally.
Yes. And what would you say is the most important message that our listening audience should take home about tonight's show and about stroke, more importantly?
Well, when I came to Harlem a couple of years ago, I said, why are we not helping these people? And the reason being, probably the most important reason was that the patients were not getting to the hospital on time.
Got it.
So do not ignore any neurological symptom. The worst that'll happen is that you'll come to the emergency room and somebody will pat you on the back and say, go home, don't worry about it. But many times you'll be saving your life, your health, by just coming to the hospital quickly.
Correct.
And don't delay, because I know we were talking about that 3-hour window, and
3 hours is a long time.
But Dr. Michael made the point that it seems like a long time, but with the amount of things that have to happen before you can get the definitive treatment, you need to get there as soon as possible. And I always talk about this case that we had at Long Island College Hospital. We had a person come in, young person, and got these clot-busting medications to this person within 27 minutes. That's like
wonderful.
A record time. Yeah. But the outcome was extraordinary. And I saw the improvement from the time that this person came in to the time that we discharged them. We're talking about night and day difference. But because that person got there in time, their employer recognized what was happening, called the EMS, told them the right thing. They got it to the stroke center, and we took care of business. And
you're absolutely, you're so right in the sense that 3 hour, I don't even want to say 3 hours anymore, because our target now is 1 hour. We want to get those people in and treated within an hour. The 3 hours is really you're on the edge. You're going to lose a lot. Within 1 hour, you can do a lot more good, as you just said.
Yeah, it was amazing.
So, what's up, brother?
Thank you very much, Dr. Macaluso. We really appreciate you joining us
It
tonight.
was my pleasure. This is the first time I've met these gentlemen. They're wonderful people.
Excellent.
And I just wanted to say that Maurice is graduating medical school next month.
Yes, I'm proud of you.
Yeah,
I'm proud.
And he's going to be an emergency room physician, and I'm hoping that he comes back to Harlem with us.
Thank you very much. And so you know what? The next time that I'm on Health in Harlem, actually, I'll be an MD.
Get out of here
next Thursday. Yeah, man.
Hey,
that is insane.
you got some letters at the end of your name right now.
Hold up.
Excellent. Everybody, please make sure you tune in next week. Next week, our topic is going to be knee replacement, orthopedics. We're going to have Dr. Sherwood McLennan here, and we're just going to be talking about how to keep your joints and all of that stuff healthy and good.
Yeah.
So make sure you tune in next week.
And we want to thank Miss Valerie Wright. She is the producer of Health in Harlem.
That's my
We couldn't
girl.
have the show without her. We want to thank my man Sean Shivers.
My boy,
He was holding it down for like
trying to hold it down, but I did good. Yeah.
We won a 12-hour difference in Taiwan. So there were times I was like, I want to call in and try to do the show from overseas, but we were up. I had to be up and on rounds by 7 a.m. a lot of times. So it was very difficult to make that happen, but I'm glad to be back. I'll tell you that much.
No, I'm happy.
And this show is dedicated to the memory of Miss Gloria Thomas. Harlem, take care of yourself.
WHCR 90.3 FM, New York.